Good afternoon, sir. Sir, Dr. Venkatesan, sir.
Good afternoon, madam.
Sir, good afternoon, sir.
Good afternoon, madam.
We'll start within 1 minute, sir.
Okay, sure.
Thank you, sir.
Good afternoon, sir.
Good afternoon, sir.
Good afternoon, sir. My voice is audible?
Yes, sir. My voice is audible?
Yes, sir. Yes, sir.
Good afternoon, everyone present here. Respected principal, sir, guest of honor, colleagues and students, a very warm welcome to you all. Faculty of Pharmacy, Dr. MCHR Educational and Research Institute, under the benevolence of our Honorable President, sir, and Honorable Secretary, sir, is organizing a series of webinars, FDPs, and professional talks with eminent speakers from all over the globe with the vision to amplify the intellectual wealth to students, faculties, research scholars, industrialists, and pharmacists. We express our sincere thanks to Professor Dr. S. Geetalakshmi Madam, Vice Chancellor, for the constant support and guidance. In continuation with the programs conducted, Faculty of Pharmacy is organizing a webinar on basic concepts of toxicology in preclinical discovery with an eminent speaker, Dr. N. Venkatesan Natarajan, sir, Professor, Department of Pharmacology, Aditya Bangalore Institute of Pharmacy Education and Research, Bangalore. Welcome you, sir.
Yes, madam. Thank you.
Yes, sir. Now I request Professor Mrs. Geetalakshmi Madam, Vice Principal of Faculty of Pharmacy, Dr. MCHR Educational and Research Institute, to give welcome address. Welcome you, ma'am.
Thank you, Mrs. Devi, ma'am. The capacity to learn is gift. Ma'am, am I audible?
Yes, ma'am. Yes, ma'am. You are audible, ma'am.
Yes, ma'am. The capacity to learn is gift. The ability to learn is skill, and willingness to learn is choice. It's my lovely obligations to offer each of you the pleasant greeting and bid you all on a genuine welcome for today's program. So let's open today's global gathering of webinar session to discuss and share the information on basic concepts of toxicology in preclinical drug development. Furthermore, today is an important day to share the skills and getting increased thorough knowledge about the toxicological effects over the drug development process through our eminent speaker. And at this juncture, we would like to dedicate our heartfelt thanks and respect to our Founder Chancellor, Dr. A.C. Shanmugam, sir, our beloved President, Engineer Thiru A.C.S. Arun Kumar, sir, our Honorable Secretary, Thiru A. Ravi Kumar, sir, and our Vice Chancellor, Dr. S. Geetalakshmi, ma'am. I am glad to welcome Dr. N. Harikrishnan, Principal, Faculty of Pharmacy, for what we are today because of his untiring and persistent effort towards the Faculty of Pharmacy. Every time while we undertake a worthy effort, he had motivated and been with us to ensure that we achieve in all the endeavors. We welcome you, sir. I also extend my exultant invite to our speaker, Dr. N. Venkatesan, Professor, Department of Pharmacology, Aditya Bangalore Institute of Pharmacy Education and Research. I also welcome all the participants, which is enlightening us at our various curiosity and thirst to learn more. Last but not least, I also welcome all my colleagues, research scholars, students, and all the other participants from all over the area in and around India who came here to gain and trade more insight and learn new data of various informative topics, basic concepts of toxicology in preclinical drug discovery. I request each and everyone to utilize this impending hours and enlighten yourself with an incredible information. I thank our management, Principal Sir, for granting this opportunity to welcome everybody for this informative webinar. Welcome you all.
Thank you, ma'am. Now I request Dr. Siddharth sir to introduce the speaker of the day. Over to you, sir.
Yes, ma'am. Thank you, ma'am. Good afternoon to all.
Yes, sir. Audible, sir. You're audible.
Dr. N. Venkatesan, currently working as professor in Department of Madam?
You're audible, sir.
Okay, madam. Dr. N. Venkatesan, currently working as professor in the Department of Pharmacology, Aditya Bangalore Institute of Pharmacy Education and Research, Bangalore, Karnataka. He completed PhD in the Department of Pharmacy in Annamalai University. He received a grant from UGC PSR Fellowship for his doctoral studies. He has 11 years teaching experience and 4 years research experience. He has published around 10 publications in peer-reviewed journals. He has guided around 25 BG students projects and currently doing 3 PhD research projects. He is the chief editor of current nutraceuticals journals in Bentham Science Publishers and also reviewers in many reputed journals, and live members of APTI, Indian Pharmacological Society, Indian Pharmacy Graduates Association, and American Pharmacological Society. Welcome, sir.
Thank you, sir.
Thank you, sir. Now I welcome Professor Dr. Venkatesh Natarajan, sir, to grace the occasion. Welcome you, sir.
Thank you, madam. Shall I start the session, madam?
Sure, sir.
Screen is visible, sir, visible.
Presentation
yes.
mode. Presentation mode.
இந்த மோட்ல உங்களுக்கு
இல்ல presentation mode கொண்டு வரேன் நானு.
கொண்டு வந்துருங்க. Yes, sir. Yes, sir.
So, good afternoon, one and all. Myself, Dr. Venkatesh, working a professor in Department of Pharmacology, Aditya Bangalore Institute of Pharmacy Education and Research, Bangalore. So, today my topic is.
Okay, sir. Okay, sir.
Just a minute, sir. My screen is.
Yes, sir.
I will move that. Okay. So, my topic is basic concept of toxicology in preclinical and drug discovery. So, before the starting of the session, I want to explain to the two things. What is the relationship of the drug discovery and toxicology? So, whenever we are finding to the new chemical entity or new drug discovery, we should know about the side effects or toxic level of the drug. That is called to the, that type of the study called to the toxicology. So, preclinical, everybody is knowing meaning of the preclinical means research using the animals to find out the drug procedure or treatment is likely to be useful. We are using to these animals for the preclinical studies. In the animals only, we will go for the toxicological studies. So, fine. Now we come to the point of the toxicology. What is the meaning of the toxicology? Toxicology means is the branch of science concerned with the natural effects and the detection of the poisons. This is one definition, and another one definition means toxicology is study of the adverse effects of chemicals in living systems. So here I am mentioning to this adverse effects. Toxicology is the study of the adverse effects. First, before that study, we should know two definitions. One is the adverse effects, another one is the side effects. What is the meaning of the adverse effects? What is the meaning of side effects? In toxicology, we are studying about only for the adverse effects. Adverse effects means you understand first it's an unintended pharmacological effect. Unintended pharmacological effect that occurs when medication is administered correctly. Side effects means unwanted effect that occurs due to the drug therapy. Adverse effects means unintended pharmacological effects, which we are not planned, but we are not expecting to the effect that it will come. It will outcomes is the adverse effects. Side effects means unwanted. There is no need that affect the effect. That is called to the side effects. Okay. Here some characteristics of the toxicological studies. One is the mechanical reaction and exposure to the chemicals, physiology and pharmacology by using the toxin agents. Then identification, quantification of the concepts, discovery of the new drugs and pesticides, developments and standardization of regulation protect the human and the environment from the adverse effects. Okay. Now, why we need the toxicology? See, the questions will come. Preclinical studies, why we want to use the animals? We will new drug finding, why we use to the animals? So very simple. Humans have a similar biological and physiological system of the animals. Both animal systems and the human's body system, like the biological and the physiological system, both are similar. That's why we are finding through this toxicity in the animals. That's a very important thing. The second one is the parity, one type of the measurement level in the toxicity to find to the quality of the drug. Third one is RSL. RSL is determined to the quantity of the exposure of the chemicals. Quantity exposure of chemicals. Okay, next start the toxicology in toxicology. So already we know about that Popal gas tragedy. It's the first world worst gas tragedy in the Popal in 1984 December 2nd and 3rd happened. Around 2,500 people died up to the 2008. This is the latest survey. 2,500 people died. So why it happened? This is industrial gas lived in that area in the isocyanate gas, IPN gas. So that is also one type of the toxic effect into the environmental surplus. Industrial gas causes to the toxic effect of the society. So in pharma, medical devices, biotech, and cosmetics products manufacturing, pesticides, and some vaccines also causes to the toxic effect of the society. Next, chemicals. Chemicals, we are using everywhere we are using the chemicals. We are wearing the cloth, we are wearing the chappals, even food, junk food items, everywhere they are using to the chemical. But the thinking is, why it causes to the toxic chemicals, why it causes to the toxic? It will cause to the more level. If high doses are highly administered to the chemicals, or highly swallow the chemicals, like a gas or solid, any item. It's highly swallowed or highly administered to the chemicals, it causes to the toxic. It comes to the toxic and the damage to our health. So the first, now we will get the two type of the questions will come. One is that how do you ensure your chemicals safely? Then toxicology, how they clear that answer. We set out the answer for the chemicals spreading to the toxic. So the toxicologist of persons to find to the answer or to find the action of the toxic substances. Like the chemical substance causes to the toxic effect, that's toxicology. As you know, for our pharmacology subject also, the study is cholinergic drugs. The cholinergic drugs like this, isocyanate, isofluorophate, monothreon, parathion, these are the gases. Organophosphorus compound is contained with organophosphorus compound, it will cause to the paralysis and the respiratory depressions, lot of side effects. So these are our pharma drugs. Monothreon is used as an insecticide. These are the causes to the toxic, harmful of our organs. Here, what are the things we want to do about that toxic studies? One is the chemicals. Chemicals where it happens, which organ to do that is called the carbon organs. The second, the toxicology to find it to the action of the toxic agents, then whether it is a reversible to the or prepared to the toxic substances. That is the toxicologist try to find to say the outcome of the answers. Okay, next. The same will continue. The effects of the chemical also depend on how long you are exposed to the chemical. Like the two type of the exposure are. One is the acute exposure, another one is the chronic exposure. As you know very well, acute means very short. Acute toxic means very short. It's like this, what is the acid burn? It's a common. Then chronic exposure means everybody can know that is a cigarette smoke. It's a long, it will happen for this, then going long happen to this cancer method. So two type of the toxic exposures are there. One is the acute, another one is the chronic. Okay. we come to this. What is the role of the toxicologist? Toxicologists find the effects of the chemical. First, they are knowing to the action of the chemical. In that action, they are collecting the data in the laboratory. That's very important. They know. So before that, chemical, you know the research about a new chemical. Before that, they know some action of the. What is that toxic effect? It's very important. They use their skills. Toxicologists find the files. They use the skill to predict where is the encounter the same chemical. I mean, how it will fit to the chemical substance diseases. And chemicals have a safe threshold level. Exposure the below which nothing that is not insignificant. So, next, prediction and the regulation of safe chemical points to uses of the safe level chemicals. What is the important when making regulation to protect people and the environment harmful effects of the chemicals? Second, in real life situation, it's not just the toxicity of the chemical. The risk associated with how it is used is very important. The toxicologist assists making the regulation by finding out the risk in the use of the chemical. Likely the chemical is to cause harm in the situation. With this information, they can make a recommendation about how to minimize the risk. Not only minimize the risk, how to handle to the chemicals. And quality, quantity. That's also knowing about it. So that's why common chemical bodies, what are the things they mentioned? It's highly inflammable. Keep away from the pharmacology, keep away from the children. And protect the protect away from the sunlight. That's the precaution they should give. That is called the prediction and the regulation for the safe chemical use. So now we come to the point next. Chemicals. Chemical bodies into the epithelial tissues, connective tissue, muscle tissue, and nerve tissue. And tissues operate with the loss of the organ and entire of the organ system will be So now we come to this toxic substance, how to damage the cells. It's a mild damage to cytoplasmic component. Then, so now mild damage means automatically our cells become to the repairing. It's having the capacity. Automatically repair to our tissues, then tissues depend on the normal function. Okay. If it is not irreversible, what happens? It causes to the cell death. It causes to the cell death, then necrosis. Necrosis means it separates back. It separates back in the particular tissues or cells. Next, BPR and the shrinkage causes to the apoptosis program in the cell suicide. Non-lethal damage to the DNA or changes in the growth pattern low cancer. Okay. So now we'll come to this point. Next point is the drug development process. One is the non-clinical. Non-clinical means preclinical studies. We are not used to humans. So clinical studies we use in the humans. Non-clinical, then phase 1, phase 2, phase 3 clinical trials. Very high end means investigational new drug. This is the process. So finding the new drug, so develop the new drug. And NDA, the NDA means new drug application, BLA approval to get the approval of the new products. Okay. Next, duration and the frequency of the exposure. Exposure means how much the toxic agent has. First is the acute. Acute means less than 24 hours of the toxic agent. Subacute, typical exposure up to 1 month. Subchronic, 1 to 3 months. Chronic, more than 3 months up to 2 years of the toxic agent. Then, what are the goals? Goals of the toxicity to identify the potential organ for the toxicity. Then, dose response. Dose response also is a higher doses causes to the toxic agent than immunogenicity. Immunogenicity determine the safety precaution for the clinical monitoring to get the initial starting dose and dose continuation in the humans. Next, selection of the animal species. Selection of the animal species means similar to the humans.
physiological action and pharmacological action. 6 months. So practically we select from the animals into the animal and the experimental purpose. We connect to the data and the therapeutic classes of the experiment.
Excuse me, sir. Excuse me, sir. Sorry for the interruption, sir. We are not able to hear your voice clearly, sir.
Just a minute, madam. From now only or before itself?
Now we are able to hear, sir. Just to say 20 to 30 seconds, we were not able to hear clearly, sir.
So shall I continue? I want to go back, madam. Shall I continue? No.
One slide back, sir. Continue. No issue, sir. Yes, sir. You can continue.
Okay. So the next is the selection of the animal species. That's the human relevances of the studies needed to the physiology action. Then pharmacological action means drug action. Pathogenesis means the development of the disease and the metabolism, pharmacokinetic characteristics, both absorption, distribution, metabolism, and the other, and the excretion. All the characteristics we should study into the toxicity. Okay. Non-clinical safety supports in the clinical trials. So, what are the non-clinical safety supporting things? One is the assumption. Assumption means animal models predict to the human biology. Then use of the high doses to identify to the adverse responses. The purpose of the non-clinical safety is that characterize the toxic effects and the doses, identify the target organs and how it will act on the organ. Then the tolerance develop or not. Then identify the biomarkers. Biomarkers means all the biomarkers like the kidney function test, liver function test, and the lipid profile, what the blood, total blood count, everything that we will show the biomarkers considered. Then those response will get it or not. If you will not get it, again we will go to the back to the studies. Okay. Then estimate the NOEL. Estimate the NOEL. NOEL means no observed effective level. NOAEL means no observed adverse effect level. NOAEL means lowest observed adverse effect level. MTD is the maximum tolerated dose. In that all the characteristics we should measure into the toxicology studies. So then finally we will find to the which doses causes to the means mortality or adverse effects. This is the graph. For example, we will take it to the whole drug. You know, so 35 mg up to the 35 mg it will cause us to the mortality. So first to 5 mg we will administer. For 5 to 10 mg, no observed. So first to 5 mg derived no observed effective level. Derived no observed effective level means there is no any effect. Then 10 mg no observed adverse effect level. Then we will come to this when it will start. Lowest observed adverse effect level is the 18 mg, almost to the 18 mg. So we'll reach us to the 25, 23 like that with the causes to the lethal dose. The animals may be died. It's a mortality. We reach us to the mortality. So we will select with this LOAEL, lowest observed adverse effect level of the. But we will fix it maximum to the 18 to 20. That range of the dose we will fix it for the adverse effects. Passes to the lowest adverse effect. Okay. That's what I told. This is continuation. This route and the frequency of administration should be as close as possible to the intended. Continuous administration in lab animals may be increased in order to after clearance rate. Then the level of exposure of the test animal related to the clinical exposure should be defined. Those levels should be selected to provide information on a dose response relationship, including the no observed adverse effect level. Then we will justify the dose selection and consider the dose given to the animals to expect the pharmacological and the physiological effect. That is called to the MABL, maximum anticipated biological effect level. Then multiples of human doses should be minimum of 10. So this is the next questions. Questions means how to clear to the toxic. These are toxic substances or toxic effect in the body.
First one is what are the toxic doses in animals. Second one is what are the organ. Third question, how to do the toxic doses compared to the effective in clinical dose. Then the toxicity we monitor in the patient in the clinical dose, or the toxicity reversible. With the toxic studies, we will find the answer. Okay. Next, non-clinical development. First, we will select the two single species for our toxicity studies. One rodent, one rodent. So the question, after before this is so many people rodent or the non-rodent. Very simple. Rodent is the rat, mice. These are the rodent. Non-rodent, dog, pig, monkey. Even rabbit also will come to the non-rodent. What is the rodent or the non-rodent? It's a very simple. The rodent is contained with this teeth. That is called the canine teeth. Canine teeth means only the front teeth is there. How to say Tamil. Tamil என்ன சொல்லலாம் அப்படின்னு பார்த்தீங்கன்னாக்கா அது வந்து ஒரு அதனுடைய ஃபுட்டை வந்து குறிச்சு சாப்பிடணும். கொள்ளாத வந்து சின்ன சின்னதாக எடுத்து சாப்பிடணும். அதுதான் வந்து ரொட்டன். non-rodent means அதை அப்படியே கடிச்சு சாப்பிடுறது. It means fight, full of the fight of the food. That is called the non-rodent. Based on the eating habit, based on the teeth value, they are divided into the rodent and the non-rodent. Okay. Then we will learn to the metabolic ID in the animal. Then most sensitive species, duration of the study we will mention, and finally must cover the duration of the clinical trials. Concepts and the basic idea of the toxicity study. So once we fix the dose, for example 10 mg, we fix the safety dose. Again we want to go for the repeated dose. Repeat the studies. What are the things we want to mention? Safety, and safety margin. Maximum tolerated dose. Now observe adverse effect level and safety margin. Then determine the target organ. Assess the genitals. So assess the so many studies. Whether somebody are using this, both either mixed or they say either male or female, or some studies they are using for the mixing male and female. That's a very important. So that assess the gender differences. Male animals are given the different responses. Female animals sometimes give the different responses. You should make sure the assess the gender differences also. Then reversibility. Reversibility assessment means how many hours it will take time to reverse the action. Then if again any failure happens, again you will go for the studies. That's the first one. Repeated dose toxicology study. Then second, most toxicology studies over 100 parameters are monitored. It's the duty of the toxicologist and the pathologist to do the best explanation in the report arrive at the no or the but there is target organ effects. Toxic level causes to the overgrowth stimulations. There will be maybe a liver tumors or enzyme inductions. It's the aggregated pharmacological action. Hormonal perturbation like to the causes to the pituitary, thyroid, and mammary tumors. Mammary tumors also called the breast cancer, increasing the mammary gland. Next is the development in the safety assessment. Safety assessment for the positive genotoxicity test. Genotoxicity means some chemical substances directly apply to the gene material, like DNA. It will directly damage to the DNA. And the mutation is mutations.
Yes, sir.
Amara?
Sir.
Why is it audible?
Sir. Yes, sir. It's not clearly audible, sir.
Just a minute. Just a minute.
Yes, sir. Yes, sir. Yes, sir. Sorry, sir.
Madam?
Yes, sir.
Is it okay now?
Yes, sir. It is okay, sir.
Okay, madam.
Yes, sir.
The first one is the positive genotoxicity. Genotoxicity means some chemicals directly affect to the gene material, like to the DNA damage or RNA damage. So, example to the AMP mutation as a in vivo positive genotoxicity. Then cardiovascular effect. It will affect to this like a QT interval, so like the cause of cardiac arrhythmia or any other heart problems, hyperlipidemia like that it is also. Then target organ toxicity. Poor understanding knowledge about the toxicity mechanism, lack of the biomarkers to monitor the adverse effects. So, means lack of the observation about the kidney function test or liver function test. It causes affect to the particular organs. Then poor safety organs. Final one, potential to cause the multiple organ tumors in the multiple species. Okay. These are the agencies to identify the toxicity or will submit the report. Our new drug development report, we should submit this to this agency. First one is Food and Drug Administration. Another is the Federal Food and Drug Cosmetics Act, Environmental Protection Agency, Federal Insecticide, Fungicide and Rodenticide, Food Safety and Standards Authority of India, DCGI, Drug Controller General of India, Criminal Investigation Branch, Department of Biotechnology, so funding agencies in India, and EMA, European Medicine Agency. These are the agencies identified to the toxicity of the chemical substance. We should report to our chemical, or new chemical entity causes this much of the toxic substance. And it will be this organ, it will be every report we should submit to this agency. These are some laws introduced in the year 1906, 1906 Food and Drug Cosmetics Act is adulteration of the food and drugs. 1938 legislation of the drugs and the food additives, investigation of new drug filing, human testing, phase 1, phase 2, phase 3 introduction to the 1978. Then NDA, new drug application submission in the phase 4. So first to phase 3 we will human testing and give to the IND filing. We will move to the IND filing, investigate new drug filing. Then phase 4 will submit to the new drug application. So regulatory considerations. First one, preparation and compilation of investigation of new drugs, preparation of the chemistry manufacturing controls, compilation of the preclinical identification and integrated summary, yearly clinical development plan and the rationale, investigator drug process, that's the phase 1 clinical study protocol will submit to the IDB and the FDA interaction to the contact with the review divisions, pre-investigation meeting, IND clinical hold, IND maintenance, IDB update, IND amendments. So next is risk assessment. Risk assessment in the toxicity. So first, what is the reason of what is the meaning of the risk? Risk means the probability of an adverse outcome based on the exposure and the potential of the asserters agents. Then risk assessment is the two types. One is the quantitative information and one is the qualitative information. Quantitative information is the assessment of the exposure, post susceptibility factors, magnitude of the author. Qualitative information, evidence, nature of the endpoint and the author. So it's a systematic scientific evaluation of potential adverse health effects resulting from the human of asserters agents or situation. So next. Toxicology, ADI, the formula is called the ADI, acceptable in the daily intake. So how to calculate the formula is whatever the chemicals or medicines, this much of the quantity of the toxic effect is there. That we will find it. Then only we will go for this IND application. The first formula is NOVL by safety factor. No observed effective level divided by safety factor. So safety factor is determined by the type of the study which is examined under toxicity. The benchmark dose lower bound approach will be also used. For example, toxicology. Acceptable daily input is equal to 10 by 100. So 10 by 100 means we will calculate the 0.1 per kg. That's also 0.1
this is the drug discovery process. So normally what drug will come to the market from starting to use will take 14 years. 14 years to the preclinical evaluation animal studies. It will take for this around 1 to 3 years. Second, we will go for the phase 1 clinical study. Phase 1 take the time 3 to 5 years. Continuous 3 to 5 years. And phase 2 is the 5 to 8 years. Phase 3 is the 8 to 10 years. FDA food and drug administration review 10 to 13 years. The final is the post-market surveillance, which is the 13 to 14 years, almost 1 year for the final one. This is phase 4, post-market surveillance. So the another hand is that for each and every research companies, they are 10,000 screens of the molecules. In the 10,000, first it will enter 250 molecules only enter to the preclinical stage. Then 5 only enter to the clinical test. Almost 245 failure results. Maybe so many results. 5 enter to the clinical testing, and finally 1 approved by the FDA. So then the publication after then US FDA approved study will come. So the next level, why compound fail in the development? Maybe toxicity is not properly finding the toxicity of the 21%, lack of efficacy is acting of the drug, or prolonging the duration of the drug is very less for 29%. More biopharmaceutical properties is the 39%, and the commercial value is very less. Will not move market, commercial value is very less in the 11%. These are the reasons maybe compound will be failed in the development. This is the final one, which is the drug discovery. It's a cross-functional and a multi-disciplinary program. So success.
Get the success of this. How will we get the success?
So how we will get the success? Applying the industry best practice in the self-motivation, creating an integrated efficient drug discovery and development organization, establishing the high-performance, highly collaborative project teams through effective planning and management. So management should plan the team, highly collaborative project teams, and the high performance of the work. Then leveraging the relationships means isolate from the other institutions and industry to advance the projects and strengthen our program. So these are the message about that. These are the basic concepts about the toxicological studies. So almost I completed my sections. If you have any questions, kindly ask. Hello? So I think audible.
Sir?
Madam.
Yes, sir. Yes, sir.
Please ask any questions.
Yes, sir. Yes, sir. Thank you, sir.
Yes, madam.
Thank you for the thoughtful presentation on concept and importance of toxicology in preclinical drug discovery. Really, sir, really it was very useful for our students as well as faculties to expand their views in concept of toxicology in new drug discovery.
Okay, thank you, madam.
Thank you, sir. Now I request our respected principal, sir, to issue the E-certificate to Professor Dr. Venkatesh Natarajan, sir. Madam.
Video.
Yes, sir. Sir, kindly accept
Thank you, madam.
as a token of our appreciation, sir.
Thank you so much, madam. Thank you, madam.
Thank you, sir. Now I request Dr. Kiranmai, madam, to carry out the session with the queries from participants. Okay. Over to you, ma'am.
Okay, good afternoon, sir.
Yeah,
Thank you
madam.
for the session. So these are some of the questions posted by our students. So can you
Yes,
please
madam.
tell us about the differences phytotoxicity, teratogenicity, and maternal toxicity in preclinical phase? So how
Madam,
these?
Yeah, fine, madam. Characterize. Characterize means it's a fetus defect. But
Okay, sir.
same like we can use it to the animals also, fetus defect, anything is that. What is the reason fetus defect is caused? That is the teratogenesis. As well as carcinogenesis is a tumor studies, madam. Carcinogenic agent, how it causes to the cancer.
Okay.
Like the carcinogenicity studies, the mutagenicity is the mutation, like the genetic material defects, like the DNA repairing or RNA does not function, protein synthesis does not happen properly. These are comes under the mutagenicity studies.
Okay, sir. Thank you, sir. One more question, sir. It's better to use whether it is subacute toxicity studies or subchronic toxicity studies.
Most of the research for our level research, we will go for the subacute. So acute toxicity studies only we are going for the highest dose level. As you know, that is a 423 guidelines we are using for 300, 500, and 2000 mg. 2000 mg, if there is no toxicity, means will come down.
Yes,
okay,
sir.
now once we fix it the dose, that doses again we will divide it, madam. 50 to 250, 500, 1000.
Yes,
this
sir.
is I'm saying this is subacute. Subacute toxicity is a repeated dose toxicity. It's enough for the 21 days, maximum 21 days is enough.
Okay.
So basically we will go for a subacute. Subchronic is a long dose. Our level, PhD level or PG student level, fine to the acute toxicity is fine. So 2000 level, 2000 mg, there is no toxicity. We will divide the dose 1 by 10. Maximum will consider to this 200 mg. That's all. Or if there is no something also 1 by 10 or 1 by 15 also, we can consider now. So that acute toxicity. So further needed to the further instate to the safety level, we go for the subacute. Subacute is a repeated dose studies. Acute toxicity is single dose administration. Then repeated doses means daily we should administer the 200 mg per 21 days in the subacute. So best is the subacute, you will get a prompt result. And then it's having the toxic level. How much of the toxic level? How it will happen to the body weight? We will measure the body weight, the blood counting, the total blood count, and the lipid profile. Everything we will measure with the subacute. So best for the subacute. Subacute is the most common.
Yes. Thank you, sir. One more question. What is the ideal method to calculate this LD50 value, sir? Many methods to calculate LD50. What is the one of the most reliable method to calculate LD50?
Madam, lethal dose means mortality. That's why I told you the graph, no, madam. MUEL. Okay, no, that no observed level to lowest observed level. That's all. Lowest observed level, which one you will find it? For example, 10 to 20 mg in the middle, 15 you will find to the death rate. Sorry, the not lowest toxic level. So more than 20, it will cause to the death rate. So you can come to the 18, 19 is the fixed for you. LD50, you can fix it. Lethal dose.
Okay, sir. Thank you, sir. So, dear participants, any more questions you can post in chat box. Kindly please post in chat box any sorts of queries, or you want any information regarding research, please kindly post in chat box.
Dear students, kindly complete the feedback form which was shared in your chat box.
So now without any further delay, I'll just proceed for vote of thanks. So gratitude unlocks the fullness of life. It turns what we have into enough and more. It turns denial into acceptance, chores to order, and confusion to clarity. Honorable Principal Sir, esteemed speaker, faculties, and dear students, I, Dr. GVN Kiranmai, took my privilege to have been asked to propose vote of thanks on this occasion. First and foremost, I thank our special speaker, Dr. N. Venkatesan Sir, Professor, Department of Pharmacology, Aditya Bangalore Institute of Pharmacy Education and Research, Bangalore, Karnataka, and for your valuable speech on importance of toxicology in the preclinical phase. We are always in depth to express our special thanks to our founder chancellor, Dr. A.C.S. Shanmugam Sir, Honorable President, Dr. S. Arun Sir, Honorable Secretary Thiru A. Ravikumar Sir, for their constant encouragement, being the inspiring role models and strengthening us in all educational related activities. Our Vice Chancellor, Dr. S. Geeta Lakshmi Ma'am, for her valuable time, concern, and constant appreciation in our works, which enlighten or heighten up our spirits at all times. Leadership is the capacity to translate the vision into reality. So at utmost, we have to convey our heartfelt thanks to our beloved principal, Sir Dr. N. Harikrishnan, sir, for his valuable contribution, guidance, and encouragement in all our efforts. Thank you very much, sir. On this note, I would like to conclude my speech and hope that this would have been enlightened you all with a good information on toxicology role in the preclinical phase. Participant, please kindly fill the feedback form which is posted in the chat box so that you will receive your e-certificate soon to your registered mail ID. Hope to see you all in next event. Thank you, one and all, for raising this on. Thank you.
Thank you. So I would like to thank to the Dr. University Management and Honorable Principal Sir, and thanks for finding to see my friend Dr. Sindel Raj, and thank you so much for giving this opportunity. So sir, participating in this session, I thank you very much to all. Thank you.
Thank you, sir. Thank you so much, sir.
Shall I leave the meeting, madam?
Yes, sir.
Okay, thank you.
Thank you.